All right, good evening, everyone from Houston, Texas, US, and good morning, everyone from Vietnam. Okay, so today I'm going to talk the part 2 of our lesson about the dyspnea. So last time we talked about how to do the history, right? We collected information about the medical history, about the present illness history, and then also physical, surgical history, family history, travel history. So today I'm going to talk a little bit more about the next step after we collecting all information. And of course, in the real life, right? In the real life, after you ask the patient the history, and the next step we're going to do is physical exam, right? So when you do physical exam, of course, you want to have some transition sentences to tell the patient that what we to do next. That is always is the case when you do the interact with the patient. So like in real life, he said, hey, thank you, Mr. Smith. Thank you, Mr. Smith, providing all information. So next step I'm going to do is something like this, right? I'm going to do some physical exam to find out what's going on with you, right? So then you start doing physical exam on the patient. And then of course, you want to check the respiratory rate, you want to check the pulse, oximetry, and whenever you want to do any action or any exam, you should tell the patient. And you want to, of course, you want to listen, you want to check the lung, check the heart, and then check out the symptoms that you think it can be relevant with the problem of the patient. You you think, for example, some symptom you want to tell the patient before you do, like, can I listen to the heart and the lungs? That you can tell the patient. You want to clearly want to listen to the lung, right? Or during when you hearing the lung, you want to tell the patient, can you take a deep breath in and out in order to help you to listen is better. So you can tell them that. Or you can tell the person, can you hold the breath? Or if you want to check another, like check the abdomen, you can say, can I check the belly? Or let me check the legs if you think the patient may have the heart failure, you want to check the edema of the lower extremity. So that's the key point here is that whenever you do any physical exam, you try to explain to the patient what you're going to do. So that the patient can cooperate with you, and then they can see, okay, they can think that you care about them. Not like in sometimes, yeah, it's like we talk about the practice in the real life. Sometimes we just do physical exam without telling the patient what we need to do. So it's kind of the more like respect to the patient. So then I think it's a good practice when you want to do the physical exam, not only for the patient with dyspnea, but for any patient, right? And then after finishing physical exam, of course, you want to tell the patient what you think and then what's the next step. So then you can tell the patient, hey, Miss Smith, thank you for letting me do the physical exam on you, or you don't need to thank you too many times, but you can say, hey, let me share with you what I'm thinking, right? So after, so before sharing with him, you want to like recap some important information from the medical history. So then that the patient and you in the same place, in the same page, and then to make sure that all information is corrected. For example, hey, Mr. Johnson, look like you came here with us because you have the shortness of breath for 3 days. And you also have a fever, you have some productive cough. On physical exam, I found out that you have some like crackles on the right side of the lung. So I may think you may have pneumonia, right? But however, in order to make sure that it is make sure I wanted to run some tests on you. Maybe I need to have chest X-ray on you. I will check the blood to see any sign of infection. So when all the tests coming back, it may need to antibiotic, something like this. So it is the way you summarize of what you found, and then also what the patient may have, and then what the next step. So that it usually is the case when you interact with the patient. Okay. So and then here the next slide I wanted to, actually it's only this slide, it only got the summary of the way we interact with the patient. Like again, it's not only for the Dyspnea patient, but all the patient. Of course, you always want to show empathy with the patient, and then by that, but you want to show that you always listen to the patient, because sometimes in the real life we because of busy time, you always like do not listen enough for the patient. So that's why I want to emphasize about that. You try to listen when the patient wants to talk, and then you let them talk. Don't like disrupt the patient. And then when the patient talk to us, of course we collect more information, but in the meantime they feel that they respect, and then the doctor care about them. So that's why it's very important for the skill of the doctor. Here we call the bedside manner. The bedside manner, the most important is that is to listen to the patient. So you make sure that you listen to the patient and show empathy with them. And then, of course, during the conversation, you want to back and forth with the patient to make sure that the patient, you understand the patient clearly, and in the meantime, the patient also understand you clearly, right? So it is in this slide, it have some sentence, it's an example. And then, of course, here in the US, and of course, I think in the standard medical practice, it's that the patient is like the patient-centered approach, right? With the patient, we treat the patient with respect, and then the patient is the most important when we do all of the work, and then make sure that the patient has the best care. And also this slide kind of summarize about the professionalism and also ethical consideration. And of course, we as a doctor, right? When the doctor-patient, it has a professional relationship. So of course, we need to have maintain the professionalism and also ethical consideration when you interact with them. And yeah, the most important is that you need to show the respect to the patient, right? And by respect, I mean that you want to respect the patient autonomy and confidential. Some confidential, sometimes it's not like emphasized in Vietnam, but here in US, they take it very seriously, especially some is like sensitive information. We always want to assure the patient that all information they provided us, it can keep confidential, and then without disclose to any other people, any party, without their knowledge or without the consent. So that is also important. We need to emphasize when we interact with the patient, especially like sensitive. I mean, like, for example, it's about like sexual history or some like illicit drug history, something like this. So some people, if we don't want to earn the patient trust, that we can keep the information confidential, they not willing to share with us. So that's why if this issue is also important when you guys want to, when we take care of the patient. So I think here I wrap up is about the dyspnea, the part 2 from history, from the obtained history, from physical exam, and until it's a discuss with the patient, the treatment plan, and then the next step. So the next part of this talk, I wanted to share with you about the patient education. It's very common when we see the patient, especially into the outpatient setting, like smoking, like drinking, like drug use, or like weight loss. So that's it. So in terms of the Disney topic, tonight I already share with you about how we can educate the patient and then how to approach patient if they smoke, and then we wanted to advise patient to quit. So basically in real practice, we use we got 5 A's for the tobacco addressing smoking cessation. So A here is the first A we call the ask, right? Of course, before we advise the patient stop smoking, we need to make sure that we know about the patient's smoking status, right? You need to ask the if the person smoking or you to smoke or how long, if the smokes and how long and how much, and the patient did try to quit before or not. And here is some very simple question you usually ask, right? Like Mr. Johnson, Mr. Smith, do you smoke tobacco? Right? And then the person said, no, I never smoke. So of course, then our conversation stop here, right? But of course, when he said, yes, I smoke. So then we come to the next step. We ask the person like how long and how many cigarettes they smoke. And then have you ever tried to quit? So that's a basic sentence. So sentences. So we should ask the patient to understand the patient status about smoking. So it's the first A. And of course, before come to second A, I wanted to we wanted to discuss with the patient, right, about the how harmful of the smoking affected to the health, and then of course what's the benefit of quitting smoking. So in this slide, I listed here the common sentences the doctor always share with the patient. And of course, all the patients they know, but then of course, our job is to emphasize and to remind them about that, right? He can tell us, of course, quitting smoking, either you can quitting smoking, or it tells us smoking can harm the heart, lungs, or kidney, or can cause a cancer, something like this. But then in the meantime, we can tell the patient, of course, if quitting smoking, what's the benefit of smoking, right? Can lower the risk of all the diseases and can help you to improve your health, and then can help you live longer. And also tell them that some people, they said, oh, I'm smoked for 30, 40 years. I don't think it's time to quit now, or it's too late. Of course, you can assure the patient that no matter how old you are, and then even if you smoke now for a long time, quitting smoking right now is still very benefit for the health, right? And then of course you can tell them that, okay, I know that the quitting smoking is not easy, but then we are here to help. So that it have the transition part when you want to talk with the patient before you come to second A. Second A here is we call the advice, right? So the advice here is we call, when we advise the patient, you have some different level of advice. And first, for example, we need to make the patient clear that, okay, like the sentence here, they said, I think it's important for you to quit smoking now, and I'm here to help. So that is very simple question, simple sentence contain the patient. Or sometimes you have very strong and very firm to tell the patient, as a daughter, I need you to know that the quitting smoking is the most important thing you can do to protect your health now and in the future. So our staff here and me, myself, can help you with that. So we call it clear and strong. And sometimes you can try to convince the patient to quit smoking by tie the tobacco use with the patient problems the patient have. For example, like if the patient has a COPD, right? Come in with shortness of breath and then still smoking, and then of course you said, hey, Mr. Johnson, definitely your COPD getting worse with smoking, so I strongly recommend you stop smoking, something like this. Or, oh, I know that you have the child or you have the daughter has asthma, and then smoking can make the asthma worse. So if as a father, you should like stop smoking. Otherwise, the daughter will be suffer from that. Something like this. It's kind of because of personalized issue. So we can have the reason, and also we have to make the clear advice for the patient. The reason why he should quit. And then after the advice, then we have the third A, it means access. So it means that we want to determine the patient willingness to quit smoking or not, right? Some people say ready, some people they say, oh yes, I think it is a good idea to smoke now, to stop smoking now. Some people they are not, right? So yeah, if the patient willing to quit smoking right now, and of course we want to say that okay, it's wonderful, right? I understand that quitting smoking can be challenging, but I'm here to support you throughout this process. So then, if the person decided to quit, and of course we want to support them, and then to tell them that you are here for that. So it is the next step we want to tell the patient after they decide they want to quit. And of course, many of them is also not ready yet, right? They say that, yes, I'm smoking for 30 years, or I tried to quit many times before. It never succeeds, so I don't want to quit. So in this patient, with this patient, and of course, we want to ask them a little bit more why they don't want to quit. And some people, they say that, oh, doctor, I'm quit. Last time I quit, but I gained a lot of weight, so that's why I don't want to eat. When I smoke back, and then I can control my weight, so that's why I don't want to quit. Or some people they said, oh, I have very bad withdrawal symptom when I quit, so that's why I'm scared. I don't want to quit. So based on the feedback, the reason they don't want to quit, so then you can have to like respond appropriately to tell them, like if the person have a weight gain, you can explain to them that yes, of course you have to gain some weight after the stop smoking, but then is the benefit it bring back is much like it's more than the well, you can tell them that it's the benefit from stop smoking is much more outweigh of the gain weight, and then we can work the weight gain with another method too. Or if the patient say that, oh, I have a very bad withdrawal when I stop, so then okay, so we can have the medication to help you with that. So that is the like reply when the patient be on to accept the willing or unwillingness of the quitting smoking. And then the next A is the exit. Okay, exit that if when the patient decided they want to quit smoking, then of course we need to offer the patient assist, right? Assistant by provide them that we said, okay, my office staff and I are available here to assist you. We can give you all the medication you need. So, and then you also advise them that you can ask for all of the like people around you, like from spouse, from partners, friends, and co-worker that you wanted to let them know that you are quitting smoking, so then they can help you as well. So, I mean, it's the next A of the 5A. So we want to tell the patient about that, so the patient can feel that he will have a enough support when he decide to quit. Oh, I'm sorry. Okay. So the last A is mean arrange. And then, of course, this one is it's down the road when the patient decided to quit. Of course, you want to follow up with the patient, right? You want to schedule to follow up with the patient. You want to ask them to come back to see you in by 2 weeks or a month, or you want to call them over the phone to ask how he doing with the quitting process and any concern or any side effects, something like that. So always let the patient feel that he has us beside them to support them to quit. So it makes sure it is like increase the chance of successful when the patient to quit. And of course, if the patient quit smoking successfully, then of course we need to congratulate the patient. And then of course said, oh, this is the best thing you can do for the health, and congratulations. So that is how you approach the patient with when the patient will smoke, and then you want to advise the patient stop smoking. So I hope that you guys can have opportunity to practice tonight. So basically, if of course this one is kind of is very basic in the lifetime. Of course, we have some circumstances that more complicated and more sensitive conversation, but usually with the 5A here, you can address the smoking cessation education for the patient. So this is my presentation. If you guys have any questions, feel free to ask me. Anh Minh thì anh bị mute, anh bị mute nói như vậy.
Yeah, thank you, Dr. Duc Vu. Yeah, I totally agree. Counseling is a big part of what we do in practicing medicines. No matter how good the medications we give the patients, how much time we spend for the patient in clinic or in hospital, if they don't know how to take care of themselves, don't know how to take the medications properly, simply don't quit smoking when they have bad COPD, then the medication, the treatment would not be that successful. So how to counsel patient properly is really, really important. We just use the smoking cessation counseling here as the template. Hopefully you get the idea, you get the 5A structures here, and you may adapt that for other issue that you may need to counsel the patient. Yeah, whether it's about diet, it's about using medications, the patient has certain habits that are not good for them. Yeah, you may need to use this structure to format a way to counsel the patient. Of course, in details, everything have different small things to consider, but if you follow the structure, at least you know how to start, how to begin the talk, and you counsel the patient along the way. Any question? Anyone ever counsel any patient that you have experience to share or question to ask? Yeah, I know from my previous practice in Vietnam, counseling may not be that important. We don't have a lot of time actually to counsel patients properly. So yeah, take this opportunity to learn more about this. Hopefully in the future, we have more time to talk about this, and you have more time to counsel your patients in the future. make it shorter, make it more concise. But hopefully you can help your patients with your counseling much better than just giving medications. Any questions?
Well, not a question, but I wanted to share my screen to tell everyone about today's activity. Okay, let me pull it up. Okay, so today we're going to do something a little bit different. Hopefully you guys can see my screen. So we're going to have 2 TAs in the breakout rooms with you. And the first part will be a listening when one TA will be the doctor, one TA will be the patient. And what we would like you to do is listen and then reflect, meaning take notes on what you liked or what you didn't like about what the doctor is saying or doing or behaving. And then we will talk about it, we will discuss it. And then you can tell us, oh, I liked it when the doctor spoke kindly. I liked it when the doctor used simple language. And we'll reflect on that. And then we'll give you an opportunity to educate us. The TAs will be the patient, and you can educate us on something that you generally educate people on in your specialty. So for example, I'm family medicine, and I often educate people on how to manage their diet. What is a healthy diet? And sometimes it takes just 1 minute, 2 minutes, 3 minutes. So that'll be our opportunity for today. So some reflection and then some opportunities for you to educate us. Okay. Anh Dean phụ bác sĩ của chương trình được không?
Để mình như thế này nhé, mình sẽ copy cái breakout room á, trong cái chat á, thì tất cả mọi người đều có thể thấy hết á, để mình thử xem nhé. Ok, yeah. Thì cứ để đó thì sẽ thấy hết, để xem coi.
Cái chat là sao?
Cái chat nó có cái chỗ để mình thấy cái upload cái picture lên được. Tại sao chỗ này không được? Thường là làm được, mà bây giờ không được. Xem một chút xíu nha.
Em mới gửi cái picture lên đó.
Có thể gửi cái picture lên đó được. Mỗi lần mình làm được mà sao bữa nay không được? Ok, đó, rồi, ok, rồi mình làm được. Mình già rồi, lủng khủng hết rồi.
Rồi, so everybody have the.
Yeah. So everybody can see in the chat section, you have the breakout room. You just open and you just click on it and edit it. Bigger. Yeah.
Thị Huyền, you still here? You know which room you belong to?